So it's 10:30. Let's get started. I'm Liz Jennings. I'm Employer Engagement Specialist with CareerForce. Welcome to the virtual career fair for August 24th, 2020. As we proceed today, you can ask questions in the Q&A box. The Q&A is the area with the little question mark. You can type a question in, and after each presenter, I'll be reading a couple of the questions. Feel free to turn on subtitles if you'd like by clicking on the CC button at the bottom of the screen and choosing the language in the gear wheel area. And also sign in on the attendance form in the Q&A area. I've posted the link there. If that doesn't work for you for some reason, that's okay. Just type in your first and last name and your zip code in the Q&A area. I won't publish it publicly, but I'll be able to get that name and I'll mark you as attended in Minnesota Works. We're so pleased today to talk about the PCA industry. I've got a number of corporations, organizations, nonprofits, people in the state of Minnesota, in all parts of the state, that have been very active in personal care assistance field. I'm pleased to welcome Minnesota First Community Solutions, Managed Resource Connections, or MRCI, Best Care, Independence Plus, Circle of Life Home Care, and Metropolitan Center for Independent Living. I'd like to start the morning by welcoming Vicki Garrett, Executive Director of Minnesota First Community Solutions. She's going to set the scene for us and tell us, give us an overview of the PCA industry. Welcome, Vicki.
Thank you, Liz. Good morning, everyone. As Liz says, my name is Vicki Garrett, and I'm the Executive Director of Minnesota First Community Solutions, and I provide executive leadership to the Minnesota First Provider Alliance. All of the agencies on the call today are members of the Alliance, and we're thrilled to be a part of this virtual job fair about the PCA, or Personal Care Assistance Program. And we really want to thank Liz for all the work she's done to coordinate this event. Next slide. So what are these two organizations? The Minnesota First Provider Alliance supports providers who support people. It's a membership association for personal care agencies that strives to promote quality service and build integrity in the industry through developing best practices. The Alliance was formed in 2016 because there really wasn't an association that supported personal care agencies. It's made up of almost 100 provider agencies that support tens of thousands of workers and people who receive the service. During COVID-19, the Alliance helped to secure personal protective equipment for agencies that were not able to access their own. And we also provided guidance to try to figure out how to work in this new world that we found ourselves in. Next slide. And then in June of this year, we formed a new nonprofit that's affiliated with the Alliance. Minnesota First Community Solutions supports the people who access the service, the workers that provide the care, and agencies. So it's a broader organization. We're just going through our strategic planning process, and just this last Thursday, we drafted our new mission statement, which is to inspire excellence in the provision of personalized services so people who rely on these services can live the life they choose. Next slide. I want to spend a little time talking about how the PCA work can be a position that leads to career paths in many different industries. It can lead to healthcare jobs, such as a certified nursing assistant, an LPN or an RN, or social service jobs, such as working in a group home or day program, where there may be career advancement opportunities. Working as a PCA is a great job to have while going to school. It allows a lot of flexibility. And just a bit about my story. I went to school for vocational rehabilitation at the University of Wisconsin-Stout. I worked as a direct care staff while in school and was my first job after I graduated. I was promoted to a case manager at the day program where I first worked. I then moved to Minnesota and worked for an agency where I had 8 different positions. Some were promotions, some were lateral moves. I've been in executive positions since 2005, but I really feel that it's the work that I did in direct care that has most helped shape how I approach my work. Other possible career paths from the PCA work are therapies such as speech, occupational, or physical therapies. And then there's business and administrative or customer service positions. I know many people at the agencies where I worked who started in direct care and then moved into administrative or customer service positions. At one of the agencies where I worked, there was a guy who worked as a PCA for his sister. The qualified professional from the agency got to know him at the visits that she did that are a requirement for the service. The PCA was bilingual, and the QP told him about a customer service position that was opening at the agency. He applied, was hired, and has since moved to another department, and recently he was promoted to a manager. I also want to let you know that there are people that make direct care work their life work. They develop great relationships with people they support and get fulfillment from their work and do not want to move on or move up. I work with a woman who just celebrated her 39th anniversary in a direct care position. Next slide. So if you're wondering, what does a direct care position or a PCA look like? If you Google Anchor, which is a national association, they have a few examples on their website. So just Google Anchor Realistic Job Preview. Here's my email address, should you have any questions for me. And my colleagues on this call will be providing a lot more information about the work of a PCA and the types of positions that their organizations are hiring for. Thank you.
Thank you, Vicki. Now I would like to welcome Julie Lux of MRCI, who's going to tell us a little bit more about the PCA industry and what MRCI does.
Good morning, all. My name is Julie Lux with MRCI. Currently, I assist with strategic relation and government affairs. So I help our families up at the Capitol when they can't be there have a voice. Next slide, please. So MRCI, Managed Resources and Connections Incorporated, started over 65 years ago, helping individuals who are transitioning from state institutional facilities into the community. They helped with rehabilitative services like PT and OT, and then gradually moved on to employment rehabilitative services. And currently, the folks that we serve are all working out in the community and may need a job coach or employment services to just get them into the right place that they want to work at. The department that I work in started in 1998 with the Robert Wood Johnson Foundation and the Self-Determination Grant that really swept the nation to allow people to stay within their own homes instead of going to nursing homes, institutional facilities, or group homes. Currently, we have over 2,500 clients across the state of Minnesota. We employ over 4,600 workers, and we're serving individuals in over 60 counties throughout the state. Part of the benefits that we offer at MRCI is healthcare. So under the Affordable Care Act, if we have a qualified employee who hits their 30 hours or more per week, we do offer health insurance. We have a 403B retirement plan that an individual worker can opt into. And then 2 other benefits that we have as part of the collective bargaining agreement that is done through SEIU Healthcare is paid time off and paid holidays. So paid time off is accumulated at 1 hour for every 40 hours worked. And then there are several paid holidays throughout the year that an employee, if they are working, they get time and a half for. Next slide. So a lot of the questions that we get are, what is the difference between PCA Choice and traditional PCA services? This slide goes through and describes a number of different variations between the two. PCA Choice is the self-directed option. This is where an individual who is receiving services has a little more control over the who, what, when, where, and why. Who's coming into their home, when they're coming into the home, what they're doing, and why they're there. So the participant works with an agency like MRCI to hire on the staff that they want to have come into their home, and they're taking care of the things like scheduling, training, supervising the PCA, signing the timesheets, and submitting them to MRCI for payment. Under the choice option, or excuse me, the traditional option, there is where if an individual who's receiving services isn't totally comfortable with training, supervising, the traditional agency has more of a role where they're hiring on the worker. They may do recruiting to indicate the hours of the client needs. And the traditional agency is providing more of the supervision, the oversight for that individual. So they're scheduling the hours when the client needs them and doing more training, supervision, all those kind of items. So it's really up to the participant, the individual who's receiving services, which path that they want to go on to. Next slide, please. So as Vicki kind of indicated previously, other service industry jobs, as a provider, we offer a total of 9 different services that an employee can be hired on to, similar to the PCA. The first one is the consumer-directed community supports. This allows workers as young as 15 to be hired on to provide care within the home, just like a PCA. The consumer support grant is also a very similar job, where again, a worker can be as young as 15 to be hired into the home. And with these two, the CDCS and CSG, this allows the participant to have more control of the who, what, when, where, and why. Personal supports and respite are licensed services that an individual can hire a worker to come into their home and provide care. So on this slide, we have our website along with our employment website, where if you're looking for a job, on our website on the very top, there's a career link. If you click on there, it'll list all the different postings that we have available throughout the state. We are in southern Minnesota, we're in the metro, and then we have several different sites in some of our more rural areas as well that people are looking for workers. So please log on and take a look. You may also find some of our job postings on Indeed. That's another great resource for you to go to if you're looking for a PCA job. Next slide, please. So some of the job duties, you may be asking yourself, well, what does a PCA do? These 10 categories are areas that a person can be assessed at where they need help. So there's dressing, bathing, grooming, eating, transferring, mobility, positioning, toileting, healthcare needs, and community engagement. A big part of being out in the community is being able to go out and do different fun things. So a PCA can certainly assist with those as needed. Next slide. So again, if you have further questions, please feel free to contact me, but I'm going to pass it off to another one of my colleagues. Thank you.
Thanks, Julie. Before we do that, though, there's a couple of questions coming in. One person has an LPN. Is there ever a role for someone with a nursing degree to work as a PCA or work in the industry?
Under the PCA program, you can do what's called qualified supervision visits under an RN. So an agency may need an RN to come in and visit with some of the complex health individuals to do a care plan, see what kind of healthcare needs they have. And some traditional agencies may also use the RN for training purposes.
Good. Yeah, so that there would be an opportunity for someone. And then do you ever have administrative positions? We know that there are a number of people, someone says they have an accounting background or a business background. Do you ever have openings for those?
If you go to mymrci.org and at the top there's the careers link. If you check out there, you may see different administrative or office jobs that we have available at this time. I know we're always hiring, so please take a look.
Good. So I've posted that hyperlink to mymrci.org in the Q&A area. Also, you're having a Zoom conversation at 11:30, right, Julie?
Correct. If you have more questions on MRCI, feel free to log into our Zoom and I'll be there from 11:30 to 12:30.
I've posted the Zoom link and the call or the call-in number with the meeting ID and the password in the Q&A area. So everyone, you should be able to pull it out there. And also to all of the people that are interested in talking with you more, I also posted that information in the email with the hyperlink for today's information. So just look in that email, and the Zoom link to talk to Julie is in there as well. So thank you for being on the call today.
Thank you for having me.
I'd like to welcome now the team from Best Care. We have Daniel Domeyer and Leanne Lindahl. Welcome.
Thank you. This is Leanne Lindahl, Chief Strategy Officer at Best Care. And I think
Hi, this is Danielle, and I am in the role of a qualified professional as a social worker.
So this is Leanne. I'm just going to talk today about who Best Care is and what kind of positions are available. Best Care, which was founded in 2005 by Andre Best, is a home care agency that offers personal care assistance, PCA services, and 245D services statewide. These services support individuals of all ages who need help in their homes with health-related needs, as Julie was mentioning earlier, and daily activities. The goal of PCA services, as with other home care options, is to help individuals live independently in their homes and community. Our mission is simple. It is to assist our clients so they can live at home and remain independent, and to support our caregivers so they can concentrate on providing great care. I will also mention that for everyone that you'll hear a lot about PCAs and caregivers and direct support professionals. It's actually all one and the same. So that just so you're not confused. Best Care has 2 locations, one in St. Paul that serves the metro and southern Minnesota, and one in Grand Rapids, Minnesota that serves northern Minnesota, including Duluth, Brainerd, Bemidji areas. Jobs within our agency, current openings, we do have a care experience specialist, which is administrative for the intake team. And that, I put down kind of what the hours, how much we're paying and what the qualifications are. This position provides guidance, support, and answers service questions to clients and caregivers. Personal care assistance. Many families are looking for personal care assistance. There are many ways for PCAs to connect with these families, and then we, as an agency, hire the PCA. We offer a PCA job board that you can go to, which is bestcareconnection.com. That will connect PCAs with families and individuals. Other ways to become a PCA are find families that are looking for PCAs, because there are many. Facebook has groups that constantly have families looking for PCAs. 2 of those groups are PCA Connections Minnesota and Northern Minnesota PCA Connection. College or high school job boards. Indeed, as Julie mentioned, does list PCA job opportunities, as well as care.com. And what we offer are PCAs. We offer PTO and holiday pay for all employees. PCAs start at $13.25 an hour. Wages for 245D workers are higher based on the agency reimbursement rate. We do have to honor the union collective bargaining agreement, but offer the benefits to all PCA employees, even if they do not join the union. We do strive to make it easy and convenient for people to work for our company. We offer a mobile timesheet app for ease and convenience to turn in timesheets. We are responsive to caregiver issues and questions. Our phones do get answered. We offer bilingual Spanish-speaking intake staff, as well as qualified professional staff. I'm going to hand this over to Danielle to kind of go in depth on what does a PCA and QP do.
Good morning, everyone. This is Danielle Domeyer. I have been in the helping profession for about 20 years. I do have a license in social work, and I have been a qualified professional in the PCA industry for about 5 years. So what is a PCA or a personal care assistant? PCAs are professionals who assist people with activities of daily living, their health-related tasks, observation, redirection of behaviors. And I can speak from personal experience. I did start my career in the helping profession as a PCA. I think for most of us working in the helping profession can be a calling. And so I was approached by someone and I said, sure, this sounds amazing. And what that looked like for me, my first client was a woman who lived with her family. She needed help in the mornings getting ready to go to her senior day program. So every morning for several years, I would start out at her home right around 7 o'clock. I would go in to her personal home, check in with her other family members, and help her get dressed, help her in the bathroom, help her pick out her jewelry, do her hair, and then she would watch her TV programs while I tidied up for her, clean her room, ask the family, if there were any needs, any information that I could pass on to the day program. And then we would drive over to her senior daycare center, and I would check in with the staff there and be able to pass on any information. So I was also part of a bigger team for this client that I had, and helped keep everybody in communication. This also led to other job opportunities. I would be referred by other people. Hey, we have this PCA. Maybe she can help out with your family. So I would also, through the years, have other clients. Again, this can be a stepping stone into other parts of the industry. So as Vicki Garrett had mentioned, there are day programs, group homes, working with people with developmental disabilities, all of that. And I did work as a PCA while I was in school. So I was a PCA while I was getting my human service degree. I had a PCA job while I was getting my social work degree. The next slide is qualified professional. And so now I am a qualified professional. And qualified professionals can be a registered nurse, a licensed social worker, a mental health professional, and also you can be a qualified professional if you have worked in the field for many years, and the statutes can provide more of an explanation on that. So what that looks like is really, I'm a qualified professional. It says that I provide supervision, evaluate personal care assistance, and really when I come into the home, and those meetings are scheduled regularly. For people who are 16, these meetings will happen every 60 days, or at least every 6 months. And as a PCA, you are really on the front lines. You have most of the information needed. You'll be able to communicate with other team members and let us know what's going on with your client. And so during these check-in visits, really we just want to touch base. I want to make sure, do you have the supports that you need to provide that assistance to your client? And is your client's health and safety needs being met by the services that they're receiving? So an example of that is a client that I have. This particular client, she had difficulty in change in her routine. And the PCA's issue was that they wanted to change their schedule. So they did not want to upset their client with this new change. So the PCA was able to use me, give me a call, and say, hey, I have this issue. How do I change my schedule? Can you help me with this? So I already knew ahead of time that we would be discussing this issue at the meeting. And then also during the meeting, I found out that there had been some changes to medications, and also there was some mental health and depression. And so we were able to talk about all of this, and how this ended up turning out after the meeting is the PCA, we were able to get the schedule changed. I was able to reach out to the broader support system of the client, and then the client was able to enter a day program where now they have socialization. So really, we are a team as a PCA. There is so much flexibility and opportunity to move on. Those are my stories, and I can pass this on to the next speaker. If Leanne, if you have anything you think I can add to that.
Nope, I think we should hand it off to the next. Thank you, everyone.
Thank you for participating. And this last slide has both Leanne and Danielle's email addresses if you want to contact them for more information. Thanks for participating.
Thank you.
I'd like to now welcome Mickey Kyler of Independence Plus. Is Mickey on the call? There you are.
Yes, I'm here.
Yay.
Sorry about that. This is Nikki Kyler from Independence Plus Incorporated, and we're located in Northwest Minnesota. We provide services to 21 counties. We provide personal care attendant services, as well as homemaking services, respite services, and other services under the waiver program. They kind of all sort of do the same kind of thing. We provide support, direct support, hands-on support for individuals living in their communities striving to be independent. A lot of our recipients currently live in family situations, and so we provide support for those individuals in their family situations. So it's similar to what Leanne was talking about, going into homes to provide that getting up in the morning or getting down at night, or helping with meals during the day. Especially now during the COVID, there's been a little bit more change for our people with disabilities, and how they move around in their community has been impacted quite significantly by the COVID-19. Our schedules we have quite a range of flexible hours for individuals who are looking to work. Our people that utilize the services have a variety of needs. So we have some people who work during the day, so they need to get up in the morning and get ready for work. And many of them have family or informal supports that kind of help throughout the day in different areas of their life. So there's lots of opportunities for different kinds of interaction in the community. And that goes along with the whole idea of personal assistance to go, for myself, I use PCA services to go into my community and be able to do my work. I like to go shopping. Well, if I had somebody who could take me shopping and go shopping with me, then I could have my personal care needs met while I was shopping, which would mean if I wanted to go eat somewhere, I could do that with my PCA. Right now, I am one of those people who needs a PCA. So we're always looking for individuals who can fill in little bits of time, especially in our homemaking area, in the East Grand Forks area, in Polk County. We have lots of little openings. So it's a perfect job for somebody who is going to school and would like to make some money on the side and help somebody in their community. Let's see. The respite services that we provide are also flexible, but those usually are weekend work, which could work out well for someone who is going to school, because many of our respite positions that we have open would be over weekend hours. I'm trying to see what else. We provide the training that's needed, and it's individualized. So I'm not going to train you to utilize a Hoyer lift if the individual that you're going to be working with doesn't need transfers. So you'll be trained to work with the individual that is your primary assignment, and you can add assignments to your schedule if that is something that you choose to do. So, like I said, it is very flexible. I think I have the information on.
That's great, Mickey. Yeah, and I'm
slide.
getting the sense that this position could be done by multiple people, even if you're working another part-time job or perhaps even working a full-time job, and find a position that fits your free time schedule.
Oh, yes. I need PCAs in the evenings, which is really a difficult position to fill. And I have other recipients who also need a few hours in the evening. And that could be done by someone who has a full-time job and would like to take just a couple hours, 3 evenings a week. That could come and help me eat, help me do some things in my home while my husband is away from home. So those are the kinds of things that we have open. And our big thing at Independence Plus is to support families. So while you are supporting an individual, you're also supporting a family, because disability is hard on the whole family. And I can say this because I've worked in this field a long time. I have quadriplegia, and my husband provides all kinds of informal support. But once in a while, he would like to take his cute little car and go out and ride with the cruisers, because he has a classic car. And I can't go in his car. So while he's away, he's concerned about what's happening at home. And this happens in lots of families where there's an individual who has a disability who can't do what other people in the family want to do. And the family doesn't want to leave them out. But on the other hand, as a person with a disability, I don't want my family to miss out on doing something like, if they want to go hiking, well, that's probably not really big on the top of my list of things to do. But maybe I want to stay home and paint, and well, why should my whole family stay home and paint when they want to go hiking? So it helps support families. So everybody gets to do what they really like to do and want to do, and it doesn't create this feeling of being a burden on my family. And that is a really awesome thing about doing direct service work, because it allows you to see how your job is really important in helping a person who has a disability or an elderly person live and experience independence without the constant need to depend on their family members for everything. So I just want people to understand this job is awesome.
Thank you for explaining that more, especially for many of us who've never had a loved one who needed PCA services. We don't really have a clear idea of what it looks like and how it really supports the entire family.
Yes, thank you.
Thank you for being with us today, Mickey. IndependencePlusMN.com or their telephone number 218-281-3506. It's on the screen. For a couple of you who've posted questions, thanks to Julie Lux of MRCI, who's responding to them by typing in the chat. Thank you, Julie, for typing that. I'd like to welcome now Circle of Life Home Care with John DeLue.
Good morning, and thank you for allowing us to be part of this event. And to thank everybody prior, they did an outstanding job of really explaining what PCA services are and what we do here at Circle of Life as well with our home care services. So I'm not going to elaborate so much on the role and what they do. Again, everybody's done an outstanding job in doing that. For Circle of Life, we do offer both full-time and part-time employment. A lot of our clients have family members caring for them. Again, we're focused on that in home care services, and primarily and our foundation has been in the Native American communities. Next slide, please. So again, we were established back in 2007. Pat Yeager was our owner and founder, and again, primarily working with the Native American communities, but other communities as well, with the personal home care, the homemaking services, and everything that previous presenters had presented. We are just like them as far as the types of services we do offer. Next slide, please. So a little bit about, kind of our business philosophy is, we believe in creating the partnerships and teaming up with our clients. I mean, truly we're there to honor those we serve. So our clients are important to us, the care needs, who can address those needs, whether it's a family member or somebody from within the agency. But we partner with different organizations within our tribal communities to help provide care for family members and loved ones, again, preventing them from going outside of their home for care, being in their comfort zone at home. Employment opportunities with us, we have a variety of positions. We employ over 1,000 individuals across our footprint. We have probably 900 plus personal care assistants, and those again are our warriors. They're in the streets day in and day out, working with the clients to provide that level of care. We also have administrative positions. We have client coordinators who we have those in each of our offices in Minnesota and the 6 other states, and they work on the intake side of bringing new clients on board. PCA coordinators work with our personal care assistants, helping with the training and development of those individuals, also working in the scheduling and finding clients for them as well. We do have, again, other administrative roles like receptionist. In some of our offices, we do have office managers. And we do have the registered nurse or LPN type positions as well. And currently we're actually looking for somebody in our Cass Lake office for that. Next slide. So to kind of give you an idea of kind of who we are, what we've done since our inception in 2007. We have 18 offices, employ around 1,600 people, 7 states we serve. We've touched over 25,000 lives as part of our business. 6,000 elders we're able to keep at home, avoid hospitalization. 2+ years elders stay at the home facilities. And we've created over 10,000 full-time jobs since our inception in 2017. Next slide. So again, we are a home care services organization. The type of service we provided, again, are similar to what others have stated previously. The personal care assistants, the homemaker. We do have you can visit our website, you can visit our Facebook site. We'll talk about current job opportunities out there as well. We do post on Indeed. We do have a number of current positions posted on Indeed. I am the Director of Admin and HR. Feel free to contact me at any point in time. Molly Montana, who couldn't be on the call with us today, but she is our Director of Strategy and Operations. She's been with us since the inception, 13 years, so great understanding of industry, our needs, and the training programs we put forth on any new hire related to a personal care assistant.
Thanks, John.
You're welcome.
Question I have, is it usually only young people that you hire as PCAs, or is it possible to get into the fields, over the age of 50?
Absolutely. I mean, our employment base is very diverse, from youth to elderly people that are that again just maybe retired, looking for a different opportunity, caring for a family member. But there is no, basically age that we're focusing on. We're very diverse in the type of PCAs that we employ, and office staff as well.
Right. A couple of people have asked the question, is the PCA certification different than a CNA certification? Julie Lux has posted an answer. John, how do you guys approach, CNA versus PCA?
I'd have to defer that question to Molly, and unfortunately she's not on the call, but most of our employment is in the PCA area.
Okay. Yeah, so for the person asking the question, I've copied and pasted the answer that Julie Lux had typed into. She said that CNA has specific training requirements different than the PCA. And mostly it's a Department of Human Services related issue as well. Thank you so much, John, for being on the call today. And we'll be sending out all of your all of the websites for each one of your organizations to all of the registered participants. I always send out the materials, so people will have that information if they want to talk more with you too later. Now, I would like to welcome the team from Metropolitan Center for Independent Living. We have Carolyn Davis and Kat Gordon with us today. Welcome.
Thank you. Unfortunately, Carolyn was not able to join us.
Okay.
So it's just me today.
Hello.
Hi, I'm the Director of Home-Based Services for the Personal Assistant Services Program with the Metropolitan Center for Independent Living. The Metropolitan Center for Independent Living is one of 8 centers for independent living in the state of Minnesota. Every single state in the United States has at least one, if not multiple, centers for independent living. We are not affiliated with each other. We are given budgetary consideration in federal and state budgets to help people with disabilities stay in their homes and communities. Can I go to the next slide, please? Our mission statement is removing barriers, promoting choices. We believe in a world of opportunities, choices, and the freedom to live these choices. Our philosophy is called Independent Living Philosophy. It was developed during the disability rights movement in the course of the civil rights movement. And our philosophy believes that people with disabilities have the right to choose their lives as much as anybody else, and that's the foundation of the work that we do. Our agency provides personal care assistant PCA Choice program, as well as a 245D homemaking program. A homemaking program, homemaking is house cleaning. So our personal care assistant choice program is consumer directed, as other people have discussed about what that means. We have an independent living philosophy as our focus, so we really do expect that PCAs will not be coming from what we call medical model, which is where the person going into the home or the care attendant has more knowledge about the consumer's needs and body than the consumer. We also call this the freedom to make choices, the freedom to make bad choices, the freedom to make mistakes. People are allowed to decide what they do and do not want to do with their bodies, and personal care attendants are expected to look to the consumer as their employer and their supervisor in their workplace. Our wages for PCA are $13.25 to $14 an hour, depending on the years of experience that the person brings to us. We consider both formal and informal experience, so paid experience, but also like if you have experience taking care of, grandma while she was at home or maybe helping out with a neighbor, we do count that as experience as well. For a homemaking program, the wage is $14 an hour and does not change based on experience. Can I go to the next slide, please? Who we're looking for. We're looking for people who are 18 and over. At this point, we are not able to provide the level of oversight needed for employees who are 16 or 17. We are looking for people who are responsible and reliable. We're passionate about disability rights and IL philosophy, who can pass a background check that is done by the Department of Human Services, and we do provide paid training. What we offer is a passionate belief in workers' rights, 5 holidays paid at time and a half, PTO accrual. Those are determined by the union, and all employees with MCIL get that. We have an educational grant for training or school. We provide DSP administrative supports. We provide assistance in finding the right consumer for you. We have sign-on bonuses, referral bonuses, opportunities for additional involvement in the disability rights movement, as well as advocating for DSPs with the legislature. And we also have caring and supportive in-office staff. Our PCAs come to us in a variety of life circumstances, and we definitely understand that sometimes you have to take a break, or sometimes the hours that you're working aren't good for you, life changes, kids have school. So we are definitely here to support the PCAs that are billing our program. Can I use the next slide? So our onboarding process looks like this. So you call us or you can email us, and we will email or mail you an onboarding packet depending on your preference. You can fill out the packet and send it back either by email or mail, or you can drop it off at our office too, with a copy of your IDs and PCA certificate. This is different. Prior to COVID, we had in-office onboarding sessions where we would talk through all of the paperwork to help explain it. As it stands now, if you have questions, we're happy to answer them. When we call to notify you your background check has passed, you can let us know your availability at that point, and we will connect you with consumers seeking staff with your availability and experience, so that those consumers can interview you and decide if they would like to hire you. And at that point, you and the potential consumers will interview and decide whether or not you want to work together. So again, I apologize. The person who was going to be presenting with me was Carolyn Davis, who is one of our staffing specialists, and her contact information is listed. For onboarding, you can contact David Shaw, who's our administrative leave, and he can send out the onboarding packets.
One question, Kat, that was coming through. Does homemaking include lawn care?
No.
Okay, so it's only things inside the house.
Yep, it's cleaning inside the home, laundry, but not yard care.
Right. And then what's the percentage of people who work for MCIL as a full-time PCA versus part-time?
That varies a lot. I think right now we probably have 25 to 30% of our workforce that's doing full-time hours. Typically, though, people do work more part-time because people don't generally need 40 hours of PCA work in their life. So in order to work 40 hours, most people would have to put that together with multiple consumers, and that can get a little bit complicated. We definitely do have consumers who do want full-time 40-hour-a-week staff, and so that is an opportunity that is available. It's just more rare.
Sure. Another question asking, since you've now transitioned to a remote virtual application process, do you have a way to securely email back paperwork using something like Dropbox or DocuSign?
All of our emails are encrypted. Okay. So paperwork. So for the individual emailing us, encryption would be on their end. I don't have an encrypted way for them to send that. But if somebody has concerns about that, I can definitely talk with you about your email client, because there are ways to make, like, Gmail or Microsoft do an encrypted email.
Good, thank you. And then did you say that your positions are listed on mcil-mn.org, or should we just contact you or David or Carolyn for more information?
So at this point in time, they are not listed there because our website is in the middle of being completely redone. So you are welcome to go to the website, but it's not necessarily an accurate representation of us at this time. We are expecting to roll it out, the new one out very soon. We do advertise on Indeed, but also we really encourage you to just contact us directly because our needs are changing daily based on consumer needs.
And are these W-2 types of positions, or are they 1099s?
These are not independent contractors.
Okay, so they're
That's
a
the
W-2.
question.
Yeah.
I don't know what a 1099 is versus a W-2, and sorry.
Right, like a 1099 is an independent contractor. So
yeah,
it
no,
wouldn't be that.
Not independent contractors. PCAs within a PCA Choice program are considered co-employees of the state and the consumer, but the agency provides all of that. So we provide HR, we do all of your taxes, we provide workers' comp, liability insurance on behalf of the consumer in the state. So for all intents and purposes, the agency acts as your employer in that matter.
Well, that's helpful. Thank you. Thank you very much, Kat, for participating and telling us more about MCIL.
Thank you.
I would like to invite back Vicki Garretts and Julie Lux, just to kind of recap, everything that you've heard today. Are there other thoughts that you had you wanted to share with the audience about working as a PCA?
Sure, this is Vicki Garretts again. Maybe one thing that wasn't shared is who receives PCA services and how does that happen? So individuals who receive PCA are people with developmental disabilities, physical disabilities. They go through an assessment process, and that's what determines how many hours of services they get on a day. And that can be very flexible. So if they get 5 hours a day, they might use 4 one day and they might use 6 another day. They have that flexibility. But that's why a lot of the positions are part-time, because they may not be assessed to get 40 hours a week. And people who receive services each one of them is unique, from very young children who have disabilities, people with developmental disabilities, people with physical disabilities, people with behavioral health needs, where you might do more in regards to behavioral interventions or redirection. So it really varies. And I know people gave different examples, but there wasn't kind of a clear overview of who receives them and how they get them. I just want to thank all the providers for being on this call and the information that they provided about the incredible work of a PCA and how it may benefit you in careers that you're looking for or provide you with very meaningful work. So I just hope people will consider working in this valuable industry.
Thank you. Julie, what do you have to add?
I have to agree with Vicki. I think you could hear a million success stories or a million how I got into this field type of stories, and each one is going to be a little bit unique. But I think when you start out as a PCA or into this self-directed kind of field, you don't go away from it. It's your passion and you continue on with it, and it could be a stepping stone. I think several of us have talked about our starting out stories, and I myself started out as a PCA, a direct care worker, and from there have kind of branched up, and now I get to be a voice for the families who can't be there to voice and make sure that their needs are met. So it's a wonderful opportunity, and all of us are always willing to answer questions. So even if you have one, there's never such thing as a silly question. Ask us and we'll be happy to help.
Thank you. I'm going to repost your Zoom link, and anyone on the call can join, in a few minutes when we end this call and talk with Julie a little bit more, get those really specific questions answered. We've received a couple of thanks, thanks for the presentation. And really, when we set this up, I was learning a lot by working with both of you. really understanding that this can be a great supplementary position. It's completely serving the community's needs, but it also can help supplement one's income and also feel like you're giving back. So, that's critical. One last thing too, let's address COVID. How are you addressing COVID and staying safe for both the client, the consumer, and the PCA?
I can start, and then maybe Julie, you can jump in. But we've certainly have provided a lot of information that came from the Minnesota Department of Health or the Centers for Disease Control to providers that they in turn then provide to the people that they support and their personal care attendants. A lot of agencies have done more intensive training on infection control, and then also providing the personal protective equipment, both for the worker as well as the person receiving services.
That's pretty spot on, Vicki. We make sure that we provide the important information that is coming from, like Vicki said, the Center for Disease Control, the Department of Health, to all of our families and our workers. That way they're equipped with the information ahead of time to ensure that they're providing good quality service to the individuals they serve. We had a mask drive, for example, where we make sure that we handed out masks to all of our individuals, and the more PPE we get, we just kind of put right back out the door to those workers and the families.
Good, thank you. I'm doing a couple of things here behind the scenes. So I'm going to thank all of you for participating today. It's been really great. Heather also posted great information. I learned a lot. So I'm so glad that this was really informative. Just a few plugs for Career Force information coming up. This week, Wednesday morning, we have 2 local area virtual job fairs, one in the St. Cloud area and one in Bemidji. So both of them Wednesday at 10 a.m. Sign up through the careerforcemn.com virtual and interactive services website. And also please sign up and attend next week's Career Force from Anywhere. That's my event, Virtual Career Fair, again at 10:30 next Monday, where I'll have a different combination of production, manufacturing, and customer service organizations. Here's the virtual and interactive services for career seekers. Please go over to that and find out all of the information about job clubs, resume search, events that are taking place all times and locations throughout the week. And if you haven't already, follow Career Force on your favorite social media platform, whether that's Facebook, Instagram. I believe Instagram has just started, LinkedIn, Twitter, or YouTube. And feel free to contact me, Liz Jennings, at any time. It's liz.jennings@state.mn.us. I'm the employer engagement specialist, or contact our Career Force help desk and look for positions that fit your background and skills in minnesotaworks.net. Thanks again to everyone, both on the call and presenting today. It's been great to have you. Take care.
Thank you, Liz.
Thank you.